and I'm a primary care physician in West Virginia and have been practicing medicine now for nearly 20 years, seeing tens of thousands of adults and children in my career. My patients sometimes ask me if the COVID vaccines are safe. My answer is yes. COVID vaccines are safe. They were first evaluated in tens of thousands of people who volunteered to participate in clinical trials. These clinical trials followed the same thorough safety and efficacy standards that the FDA sets for all vaccines in the United States. Since then, millions of people in the United States and around the world have received COVID-19 vaccines, and the results from the U.S. and global safety monitoring efforts are excellent. There are rigorous systems in place to quickly identify any safety concerns and take action. These monitoring systems provide information that allows public health and medical experts to update the recommendations and guidelines as needed to ensure COVID-19 vaccination is safe. When it comes down to it, COVID-19 vaccines are safe and effective. Vaccinations save lives. That's why I chose to be vaccinated and why I recommend COVID-19 vaccination to my patients and my family. Thanks for tuning in. I'm Dr. David Hess. For more information about COVID-19 vaccines or to find a location near you, visit vaccinate.wv.gov.
Get your COVID-19 vaccine, and you could win cash prizes, pickup trucks, and college scholarships. It's not too late to enter. Get a shot by Sunday, August 1st, and visit doitforbabydog.wv.gov.
Hi, I'm Dr. Catherine Moffat. I'm a physician specializing in pediatric infectious diseases at West Virginia University. My patients and their caregivers sometimes ask me if children and adolescents can have side effects from COVID-19 vaccination. There can be side effects, although not everyone has them. The side effects that children 12 and up can experience are similar to those in adults. These tend to be mild to moderate and include soreness, redness, and swelling around the injection site, tiredness, headache, chills, fever, or nausea. These effects usually last only a few days, and kids may experience some or none of them. These side effects can be a sign that the immune system is building up its natural defenses against COVID-19, but many people build protection without these signs. Similar to adults, these effects are more common after the second dose, yet that second dose is essential for maximum protection. Although these side effects can occur, they are short-lived and outweighed by the benefits of being protected through vaccination. Many cases of COVID-19 among children and teens are mild, but even mild cases in children can lead to long-term health problems. I've cared for children with COVID-19. Some of their cases can be quite severe. In fact, COVID-19 was among the 10 most common causes of death in children in 2020. And COVID-19 hospitalization rates among teens increased in the spring of 2021. COVID-19 vaccination is a safe and effective way to protect our kids against the virus. It protects not only the person who's vaccinated, but those around them as well, especially children who cannot yet get vaccinated. This is why I recommend that my patients ages 12 and older get vaccinated, and I encourage patients, parents, and caregivers to discuss COVID-19 vaccination with a healthcare provider. Thanks for tuning in. I'm Dr. Catherine Moffat. For more information about COVID-19 vaccines or to find a location near you, visit vaccinate.wv.gov.
Back to school is almost here. Has your family been vaccinated for COVID-19? West Virginians 12 and older can get vaccinated, and it's the best protection from COVID-19. Protect yourself and your family by getting vaccinated today.
I'm Dr. Jenny Yost, a physician and women's health specialist in West Virginia. I have experience providing gynecologic care to adolescents and young women for over a decade. Are COVID-19 vaccines safe for people who want to have a baby soon or in the future? The answer is yes. COVID-19 vaccines are safe for people who are pregnant, as well as those who may want to become pregnant anytime in the future. There is no evidence that any vaccine, including COVID-19 vaccines, affects people's ability to get pregnant. In fact, leading women's health associations agree that COVID-19 vaccines do not impact fertility. When you get a COVID-19 vaccine, the process of building immunity occurs in the immune system and does not impact the reproductive system. The COVID-19 vaccines have undergone very rigorous safety monitoring. There is no reason to believe that the COVID-19 vaccines will have any impact on the ability to have a baby in the future. So yes, the vaccine is safe for individuals who want to become pregnant in the future. These are just a few reasons why I recommend COVID-19 vaccination to my patients. People who are pregnant or want to get pregnant in the future can choose to get vaccinated. Thanks for tuning in. I'm Dr. Jenny Yost. For more information about COVID-19 vaccines or to find a vaccination location near you, visit vaccinate.wv.gov.
Hello, everyone. It's August the 4th, Wednesday. I'm joined today with Bernie Dolan and the great superintendent of our schools, Clayton Birch, and they'll be talking to you just very shortly about going back to school and all the good things that are about to happen right in front of us. But before I go there, I want to pay respect, and honor to 7 more great West Virginians that we've lost. We're up to 2,956 total deaths. Our 2,950th death in West Virginia was a 57-year-old male from Kanawha County. Our 2,951st death was an 82-year-old male from Wayne County. Our 2,952nd death, a 78-year-old female from Wayne County. Our 2,953rd death, a 78-year-old male from Monongahelia County. Our 2,954th death, a 68-year-old male from Berkeley County. our 2,955th death, an 86-year-old male from Morgan County, and our 2,956th death, a 75-year-old male from Cabell County. Like I said over and over, I don't know how many times I got to say it, but if you know these people, please call, or please go by and see them. You know, extend a hand of love, and if you don't know them, please keep them in your prayers, your thoughts. As Kathy and I do all the time, it's a tragedy beyond belief, and it's really, really super tragic for these people at this time. So anyway, just be with them. Thank you so much about that. From the standpoint of new cases in West Virginia, we have 382, a daily positivity rate of 5.72, cumulative rate of 4.94. It's eked back up just a little bit. Our active cases continue to grow and grow, and this is of real concern. We're at 2,848 active cases now. Our recovered cases are still over 160,000, but not growing as fast as we would like them to grow. We have 185 people that are hospitalized right now, and 70 people in the ICU units. Both of these are significantly up, and it's what we don't want to see, but we worry and are very concerned about that it is happening, and it's happening right here in West Virginia. We have 2 red counties, Marshall and Wyoming counties. We have 8 orange, 11 gold, and 14 yellow, and you can see it, it's all over the map. A reminder again, if you're 65 and older and you have any symptoms whatsoever, you got to get tested. That's all there is to it. With this Delta variant going around, you have to get tested. The antibodies will really, really help you, but if you get feeling the least bit bad, you've got to get tested. I've got to tell you about this, and last week we were doing, or a couple weeks ago rather, we were doing the sweepstakes and Do It for Baby Dog, and we were in different areas of the state. And when we were in the northern area of the state, not far away, but probably an hour away or whatever like that, I was going to read a proclamation to a young man, that the great people of Peyton City were doing for Logan Fluharty. And, he had a dreaded disease, and a big kid, a beautiful, big kid. And in high school at Peyton City High School, and he was diagnosed back in April 2020, or 2020, he was diagnosed with leukemia. And I honored him with a proclamation, but I didn't just read it here. When we were relatively close, and I said, we're going there. And they were going to have a parade for him, and there was a group called the Ohio Valley Avengers, and they were doing a special ceremony that day. And and so they picked Logan up, and they took him through the parade, and they came back, and they, all of these were, wonderful kids at that high school in the Ohio Valley Avengers. They were Spider-Man and all that, and superheroes, and they made Logan Laser Logan that day. And I am really brokenhearted, today to tell you that we lost Logan's courageous battle with leukemia. And so I send all kinds of love and thanks from Kathy and I and all those that were with me that day, to Logan and his family, and it's just terrible. It's just terrible, to see, tragedy happen to our young people. But Logan, we love you, and we love the great people of Peyton City and all those Ohio Valley Avengers and all the good stuff that they do at that high school. It was a real honor to be with you that day. Now, as far as back to school announcements and everything, I'm going to turn this thing over to our Superintendent Birch and to Bernie Dolan with the SSAC, and they're going to tell you a lot of good stuff about us going back to school and back to school plans.
Thank you, Governor Justice. It is that time of year, back to school. We have schools ready to start actually next week. By August 20th, 33 counties will be fully back to school, and by August 28th, all 55 counties. It goes without saying that we've learned a lot during the past year of the pandemic, and we've heard the governor, we've heard our state board president, Miller Hall, and others talk about the toll that it took on our children, our families, our educators, service personnel, those related to the school system. And we came into the summer, offered a summer program for many of those children. And first and foremost, I just want to thank each and every teacher, service personnel, volunteer who stepped up to make sure that all 55 counties had programs for our children this summer. The stories that each one of you have sent me were inspiring, but also set a tone of what exactly we're dealing with. The number of cases that each one of you have sent me talking about, we knew it was bad, we knew that our children suffered during the pandemic if they were not engaged with school, if they were not staying engaged with their teachers. We knew there was an issue with social emotional. And one teacher in particular wrote of the number of children just at being at the local swimming pool, and how much of a loner and trying to get them back engaged, and how much time it took for children to get engaged. So as we get ready to start off with school, you know, I hope that we keep that in mind, that we're glad to be back. We know we want consistent time for our children to be in school. We want to make sure that families also know there's the option of, we do have virtual school options still available, but that consistent daily connection to the teachers is the most important thing. Upcoming board meeting, we will be talking about some of the data from this past school year, but for today, most importantly, is we will be releasing our school recovery and guidance. This school recovery and guidance has been used during the summer, during all of our summer schools. It was actually used during all of our summer sports participations, conditioning, band, and it worked really, really well this summer to get our kids back engaged, back into their schools, back with adults, and that one caring adult in their lives. So released today will be a document called School Recovery and Guidance. It's pretty straightforward. I know we're getting a lot of questions, folks asking about, oh, what will be the same? What will be different for this year versus next year? Well, first and foremost, we're starting school in person, and we know that our county superintendents, along with their health officials, they have the support of the governor, of the board president, but also all the resources that come with that, those that really guide us through the pandemic, whether it be our DHHR partners, Dr. Marsh, General Hoyer. So many people assist us, and we want them to be prepared. They've learned so much about how to deal with this virus over the last year that we really want them to be in a position to make those decisions locally of what they need, be prepared to pivot and respond if we see an increase. But the guidance document that's released today, there's a few key pieces I think that's important. And first and foremost is we will continue with our mitigation strategies, and that is making sure that all the supplies are there necessary, just like we did last year. Anything that the schools need for disinfectant, cleaning, making sure that the environment is a clean, safe environment. Continuing to ask our teachers and children, wash your hands, practice safe hygiene. You know, we still have a mitigation strategy that our classrooms are set up to provide some core groups and evaluate large groups. If you feel you need it, wear a mask, but really the local superintendents will be looking at that individually for their counties. Contact tracing will continue, but thank you to Shannon McBee and Secretary Crouch for working with us. We had a lot of children in and out of school through some of that contact tracing, and this year we've been able to make it a little easier on families. So there's some guidance here on contact tracing, and I don't want to overlook the most important mitigation strategy that we have, and that is the vaccination right now for those 12 and older and for our teachers, staff. I believe the governor most recently has spoke to the U.S. Department of Education, Secretary of Education, and assured him that I think they were a little surprised, and as I talked to colleagues around the state, we have been holding school clinics around the state. I want to continue to thank Governor Justice that we were one of the first states that prioritized our educators and those that work in the schools for vaccination all the way back in January. We've held school clinics throughout the spring, throughout the summer, and we will continue them throughout this fall as we enter school. We are all hopeful that many, many more people take advantage of that, and it is the best protection, as we hear Dr. Marsh say, that we have on fighting this disease. We are, if you've been following any of the social media, we do have a campaign, a competition. It's I Got Vaxxed West Virginia, hashtag I Got Vaxxed WV. And we've had a lot of students that have sent in video clips of why they felt it was important to be vaccinated. We've been highlighting a lot of those students over the summer, the spring, and I really, really appreciate each and every one of those students that have stepped up. And I think the best was one that Governor Justice shared a few months ago, and that was a young man who made it very, very simple to his underclassmen. And he made us all laugh, but also brought it home when he said, if you don't want your senior year to suck like mine, get vaccinated. And that actually resonated with us. And talking to him, we really thought, how can we expand that and really encourage schools? So glad to announce today that we have put out a competition to schools to really, over the next couple months as we come back, utilize those school clinics. We want to make sure you got all the support you need, but we want to get as many folks vaccinated as possible. So we are going to offer a competition for all schools, elementary, middle, high school, and that would go for public and private. So we are looking at 12 awards that we will announce in October for the highest schools with percentages of vaccinations. And we initially had put out a brief that said, we'll look at $5,000 per school. The governor has decided to commit some dollars, and since he's really, really tough to arm wrestle with, I've decided to commit some dollars as well. And I'm glad to announce today that we will now be offering 12 schools throughout the state a $50,000 grant to that school who win that competition for the highest percentage of vaccinations in that school. So, Governor, thank you so much for that. We appreciate it. And, we're just, once again, we're going to do everything we can to support our students and teachers as we come back and enter school. And I think with that, we have Bernie Dolan here with us to talk a little bit about how the summer practicing, conditioning, and leading up to opening of our high school sports.
Good morning. And thanks, Governor, for allowing us to be a part of this. I'd like to echo Clayton's comments that, we've learned a lot over last year. And, as we finished our end of summer and beginning of fall was pretty quick. So we've been active clear up through the end of June. We started July 5th as being our conditioning that was allowed, or practice, for a 3-week window. So we've been at it since really all summer, and really have had no outbreaks to speak of that we know of. So we have started our official practice in the fall for all sports except for volleyball, all of our fall sports, and they start next week. So we think that they've gone very well. Last year, everybody was given guidelines for participation and what you had to do. All those guidelines are good, and they are recommendations for this year. They're not required, but we think that a lot of those still play a part this year. We look forward to continuing through the fall. We do encourage all players and coaches who are eligible to get vaccinated, because we know that that's the safest way and the best way to be able to participate. The guidance has been, if you are vaccinated, you don't have to quarantine. And more often than not last year, it was the quarantining that was interrupting the schedules. At this point, we don't intend on changing any of our state tournament schedules. We plan on playing them through, and so that we hope that everybody goes out and does what they need to do to make sure we're able to do that, and the kids are able to do that, because nobody wants to end up missing some of their season again. So, you know, we know kids need participation in athletics, not only for the physical well-being, but also their social and emotional well-being. So we're up and running, and we think it's off to a great start, and we look forward to keep pushing through the fall.
Are you coming back to me, Jordan? All right, well, men, you know, Clayton and Bernie, you're friends, first and foremost. You're great at what you do every day. You know, to just think of the commitment, you know, from all of our teachers, all those in the service personnel, all the people that have worked all summer doing things to be able to help the kids and help all of our school systems. And it goes all the way back, like you say, back to the winter, and everything that we've done all through this thing is, you know, we've protected our kids. I love what, you know, Bernie Dolan just told us, and Bernie, you know, in saying that, you know, everybody through the summer has gone back. They've had a window of conditioning and or practicing, and now they're back at practice and getting ready to go back at practice, I guess, in volleyball, and our football teams are getting ready, and for all practical purposes, you've said that we really haven't had any incidents, and I know from the standpoint of how it would have been reported to me, I don't know of any incidents either, and so I think that's great, and we all need to be concerned about this Delta variant, and we know that it can attack our young people more, maybe even so, than our older people. It is very, very infectious. We all know that, and we hear from our medical team and our medical experts about all that. But the absolute message that our coaches and our parents and our communities should be telling our kids is, you know, if you don't want a real interruption in your sports programs and everything else, you got to get vaccinated. That's just all there is to it. It's something that we should all be doing. It's incredibly safe, and it's just the absolute best answer that we have, period, and it's a good answer. So I thank both of you for all you've done each and every day, and you know, Superintendent Birch is quite a novel individual, and I love it, the fact that we've got another marketing campaign now. We've got another marketing campaign at the schools. You know, can you imagine, you know, whether it be in elementary school, whether it be public or private, you know, a school picking up $50,000 for the school to use in a great way, and the way they do it is the highest percentage of their school population, you know, is vaccinated, and so it's a great idea. I salute, you know, our Superintendent Birch and all those that helped him come up with the idea, and I you know, surely I jumped in and want to help from our side, and we can do so. So let's get our kids vaccinated. I think it's just great stuff and everything. It just helps us all. So anyway, thanks so much, guys. I can never thank you enough. You're superstars beyond belief, and you know me, I don't blow smoke at anybody. I just try to tell people the truth, and that's exactly how I feel. But let me go back and go through these things as quickly as I can. You know, our vaccines in the schools, we're going to be doing that, and you know, as soon as the FDA authorizes, you know, individuals to be given to individuals 12 and younger, we'll give you updates on that as we go. We're ready to support the K through 12 and the colleges and university with vaccination clinics, and we'll be ready to do so. You know, our joint interagency task force under the direction of, and they always say retired Major General, I'm just saying it's our General Hoyer and everything, to stand up tabletop exercises where they go through and they're prepared. It's just one level of more preparedness, you know, with the universities, our colleges, our schools, and everything to make sure that we're absolutely ready in every way in case there are scenarios of things that do arise and that would be on the bad side. So we want to be ready. You know, from the standpoint of National Guard funding, today I sent a letter to the President Biden requesting that he reauthorize funding for the National Guard. They have been, gosh, the National Guard has been so good. This funding is critical to our continued response and preparedness for the ongoing pandemic. So I surely hope and pray that we'll get that authorization quickly. You know, on a vaccine distribution update, we're now at 89.5% of our 65 and olders with one shot, 82.6% of our 50 and olders with one shot, and we're at 68.5% of the total population that's eligible with one shot. And we want to just keep that number moving and keep that number climbing. And I remind you over and over and over about getting the follow-up second shot. We were going with the final Do It for Baby Dog sweepstakes and everything, the final 2 big cash prizes and a couple trucks and all that. We were going with that tomorrow, but we had some kind of computer glitch that happened, I guess, you know, with so many people trying to get in and everything on Sunday evening and so with that, a bunch of people were just knocked out. And so we decided to extend this, and with all the different things that we've got going on, you know, we've got to be in Wheeling tomorrow. We've got another briefing on Friday and a briefing on Monday. And so we have decided to extend the deadline, you know, and do the final drawing on, or the final announcements on Tuesday, August the 10th. And so we extended the registration yesterday by update that we're going, but if you can get vaccinated or you can get registered on Sunday, midnight Sunday will be the cutoff now. And so you got a whole bunch of extra time. We're continuing to vaccinate lots of people in the short or last few days. And so get yourself vaccinated or get yourself registered for these prizes on the last drawing that now will be on Tuesday. You know, we've got over 378,000 now that are registered. That's bumped up significantly. We're continuing to do the booster battlefield assessment. You know, I'm getting data back, you know, on my antibodies. Like I said, you know, I was going to get that blood drawn the other day. I followed right through with that. And Marshall and WVU are going to be heading up and leading this study with the help of DHHR. And I want to read just a couple of things to you here. Also, WVU, the Healthcare Association, is going to be helping, you know, a great deal. But let me just read this. We are in the process of connecting with FDA, CDC, and the vaccine manufacturers to make sure we are providing this real-world data in a way that assists in determining if a third dose of the vaccine is best for our citizens over 60 who have had their first vaccine over 6 months ago in exactly the same format that what Israel's doing. So if you're over 60 and you had your vaccine 6 months ago, we would love for you on a voluntary basis to contact us, get your antibodies checked and everything. We'll provide the data back to you, and you know, on the assessment of whether or not you should have a booster shot and everything in order to be able to protect you. It just is the smart money and the smart thing to do. So get in touch with us and get your antibodies checked and everything, and then we'll provide that data all across our nation and across the world, and it'll help a whole bunch of people. West Virginia leads the way again, and that's what we want to continue to keep doing. We have now 118 Delta variant cases in the state. Berkeley County is the highest with 24. You know, now that it's spread to 31 of our counties. I just want to go through and make sure, you know, that I don't forget anything. But again, it's no reason to panic. These vaccines are amazingly effective in protecting you in regard to this variant and everything, or in regard to COVID. Let me just say this one more time. If you're vaccinated, the health experts the other day told us that the chances of you, if you're vaccinated, of you spreading this disease are greatly diminished. And the chances, if you're vaccinated, of you getting the Delta variant is like, you're like 99.9 against getting it. And so there's no question, you got to get vaccinated. I mean, when it really boils right down to it, just think about this, and I said this the other day. Think about sending your kids to school where all those kids are together. The odds are astronomical that one of those kids is going to have this disease, the variant. The odds are astronomical that that's going to be the case. And if that be the case, we have said over and over that if you're talking or yelling or whatever, that the amount of virus, and I'm way out of my league here, but the amount of virus that you're expelling is 1,000 to 1,400 times more than it was with COVID. And so it's everywhere. It's everywhere, no matter what we do. It's everywhere right now. It's in the mall, it's at the football game, it's everywhere. And so if it's everywhere, and your chance of getting it if you're not vaccinated is really high, or surely high enough to be concerned. And if you're vaccinated, your chance of getting it is almost zero. What are we waiting on? What in the world are we waiting on? You know, are we really willing to send our kids to school, put them all in that setting, you know, and not be vaccinated? You know, are we willing to be out on the ball fields and not be vaccinated? Are we willing to sit in the stands and not be vaccinated? It's a heck of a risk. It is one heck of a risk. And I mean, we can't mandate. I wouldn't. I don't think there's a reason to mandate at this point in time. I guess you never say never, but I see no reason to do that. But I absolutely plead with you to get vaccinated. You know, our face coverings, there's no mandate now, but it's up to you. You know, it's completely up to you. You know, and if you've got some, you know, health issues and whatever, especially if you're 65 and older, it may very well be exactly what you need to be doing and wearing a mask. Vaccine eligibility is 12 and older. I told you about getting your second shots. It's mandatory. Absolutely, you get your second shot, and not mandatory from my standpoint, but mandatory from your standpoint. It is absolutely silly to have your first shot and not follow up with your second shot. The vaccines, again, are incredibly effective. I call upon all those parents, grandparents, and everything to help us get your young people across the finish line and get them vaccinated. And all the vaccine information's up there. You know, I remind you again about getting tested. It's free. You take advantage. You know, again, thanks to Frith and Walgreens for all that they've done. And an update, we have 11 outbreaks in our long-term care facilities. That's up six more from Monday. We have 11 outbreaks in our church community in 10 counties. I always read those. That's Braxton, Cabell, Fayette, Braxton, Cabell, Fayette, Jackson, Jefferson, Marion, McDowell, Nicholas, Putnam, and Raleigh counties. We have 5 inmate cases, 2 staff cases, and I remind you all the time about giving blood. And I go back to just one thing, and it's just this. You know, Logan Fluharty was one of our beautiful, beautiful West Virginians and a beautiful kid. Bad things happen. Bad things happen that are way out of our control. And I know to God above that He's looking after Logan right now. And I know to God above that Logan can hear me. And Logan, I want you to know that all of us love you and will miss you, but we know you're in a better place. But I also want to tell all West Virginians this, that at least in my world, Logan didn't have much say in this terrible, dreaded killer that jumped all over him. But we do have a say. We do have a say in stopping this terrible killer that's out there on our doorsteps. We have a say, and that's what I truly believe that God above expects us to do. You know, the story I've told you over and over about the guy that was below the dam and he wasn't going to leave because he truly believed that God would take care of him. And the water kept coming up. And the park ranger came and said, "You got to leave," and he didn't. And then the next thing that happened is they sent a boat for him because they couldn't get there on foot. And he still wouldn't leave. And then he was up on the roof as the water kept coming, and they sent a helicopter to get him, and they were screaming at him, "Jump on, jump on, jump on." And he said, "Nope, the good Lord's going to take care of me." And then as he was going through the pearly gates, he asked the good Lord, he said, "Why in the world did you let me drown?" And the good Lord said back to him, "I tried 3 times. I sent the park ranger, I sent the boat, I sent the helicopter. You got to do a little bit for yourself." We're sending the vaccines. We need to quit reading these names. We need to quit reading the deaths that occur and everything. We can stop this thing. Logan couldn't do it, but we can. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, in following what the governor has said, certainly we all send our most sincere sympathies and best wishes to Logan and his family. We're at a critical moment for this state, I believe. All of the data, and I will be shorter than usual today, all of the data would absolutely say that the way that we can safely deal with the Delta variant and the variants to follow really truly is vaccination. And as we look at the CDC's data, look at Israel's data, look at the United Kingdom's data, look at anybody's data, like the governor gave his story about, sending help, the messenger RNA vaccines, Pfizer, Moderna, provide an 8-fold protection versus no vaccination and becoming infected with COVID-19, the Delta variant, and a 25 times protection against severe disease, hospitalizations, or deaths. And when we look at this Delta variant, which, as the governor brightly said, is much more highly infectious, exists in much higher concentrations, seems to be able to infect numbers of people, we see that there has been a relatively rapid increase in hospitalizations around our country, matching what we've seen back in last winter. And in some states like Florida and Texas that are responsible for 1 in 3 new cases of COVID in our country, we have seen that hospitalizations have started to pick up at a rapid rate, in Florida greater than they've ever seen before. And we know that people in the hospital are unvaccinated, people that are in the ICU are unvaccinated, people that are dying of COVID-19 in our country are unvaccinated. And when we see countries like the United Kingdom and Israel that are very fully vaccinated, we see that hospitalizations and death go way down even when the cases go up from this particular variant. And we're very proud of the work that has been done here. We are worried about our people. We have a very vulnerable, older, and sicker population. We're worried about some of the data, as the governor said, that many of our most vulnerable people have really been vaccinated at the very beginning of this pandemic, something that we really pushed and I'm proud of, but inadvertently that may put those people at more risk, which is why the governor has approved and directed us to do the antibody study, which we are currently starting. But I think for all people out there, and I did write a little blog about how important kindness is right now, kindness to each other. And even though we may disagree about some foundational things, our goal is to help people live well and long and protect people from the really ravaging side effects of COVID-19. Because just like I said, in Israel and the UK, where they vaccinated very fully, that they saw more cases, but fewer hospitalizations and deaths. In India, where this variant started, they didn't vaccinate very well. And they saw between 400,000 deaths, which is what they reported. And some people have looked at their data and said maybe as many as 10 times more deaths than that happened during that 10-week surge that they have with this Delta variant. It is really important that people out there help make the right decision for themselves and their families, because we don't want to see people in hospitals, ICUs, dying. And we're seeing more people today going there. And then for the first time, we've seen that change from June, where we saw the Delta variant be about 10% of our cases in West Virginia. And now in July, we've seen the Delta variant become 74% of our cases in West Virginia. So we are about to see the surge here, and we're starting the very early phases of it. And the way we can protect ourselves and our families and our state is not only pulling the rope in the same direction, running to the fire, but let's try to not have the fires. And we do that by being fully vaccinated. Thank you.
Great, thank you, Dr. Marsh. Retired Major General Jim Hoyer, Dr. Ainam Jad, and Secretary Bill Crouch are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Thank you for taking my question. Governor Justice, could I get your reaction to President Biden's statement yesterday about GOP governors, particularly the ones in Florida and Texas, but pointing at GOP governors to say, if you're not willing to in lack of a better term, institute mask mandates and things like that, then at least get out of the way and allow the federal government to do so. Those two states have taken steps to not allow mask mandates, not only not calling for one, but to not allow them to be implemented. What are your thoughts about the president's opinion and attitude toward the individual states as they exercise their rights? Thank you.
Kenny, I think, and you know me, I'm going to just tell you what I think. I'm not going to give you a politically correct answer. I'm going to tell you just this, that I don't believe that I don't believe that politics is not a major consideration with what's going on. I think you're seeing pandering to political bases and everything all the time especially out of DC. And in West Virginia, we're going to make the very best decision without any influence whatsoever from politics, one way or the other. We're going to make the best decision that we can possibly make for our people in West Virginia. I don't really care about the president, having derogatory comments about others or governors from other states having derogatory comments about whomever it may be. I think that this is such a serious issue that politics in it only diminishes the effectiveness of doing the right thing. I believe without any doubt that we should be vaccinated. And the more that we're able to vaccinate people in West Virginia, the better off we'll be. Without any question whatsoever, the more that are vaccinated, the less will die. There is no question about that at all. But from the standpoint of masks and whatever it may be, I have seen nothing that our medical experts have brought me that said, oh yeah, we got to do this, we got to make this mandatory. In West Virginia, we absolutely have led the way over and over and over. I'm telling you, without any question, we should get vaccinated. But absolutely, to start down the path of shutting stuff down or doing this or doing that maybe other states feel necessary that they need to do, that's one thing. But in West Virginia, what I would underline over and over and over, we need to get vaccinated. But absolutely, we do not need to move at this point in time to those more stringent guidelines, and we do not need to get in the middle of a political, badminton match. And that's what always happens, and it's what is going on right now, whether it be from the Republicans or it be from the Democrats. It is exactly what's going on. I'm not going to do that.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is for Superintendent Birch. I know that the Board of Education retired their color-coded map last year. The DHHR still publishes theirs. I was wondering if there was any plans to revive the map for this upcoming school year, or if the DHHR's map will have any bearing on whether or not counties are in-person, remote, etc. We're starting to see the map change, so I wondered if that would have any bearing on school or sports. Thank you.
Sure, absolutely. At this time, I don't think you'll see a separate map, but it's back to what I said earlier. It's those lessons learned. And what's happened over the course of the years, I believe that our school leaders, working hand in hand with their local health officials, still utilize that map. They pay attention to it. They understand locally if there's an issue. And because of what they went through last year, they're able to make those decisions a lot quicker, a lot more meaningful at the local level if they feel they need to do something different. So the guidance document that we've put out today really allows those superintendents and local school boards to work collaboratively with the local health department. And, I feel very good that over the course of the last year and a half, they've built those relationships to make the best decisions that they know their communities and schools need.
All right, thank you, Charles. Next to Mark Curtis with Nexstar Media.
Good morning, Governor and cabinet members. Governor, this morning, maybe Dr. Marsh can weigh on this too. This morning, the World Health Organization asked states and countries to hold off on giving any booster shots because they feel that those shots should be going to people in other countries who have not even had their first dose yet. With that in mind, will that affect your plans to go ahead with this battlefield assessment, or are you just going to, if you identify people who need a booster, are you going to go ahead and give it to them?
Well, I know I'm going to get in trouble on this answer, but Dr. Marsh, you'll probably do better than I. But in my estimation, we need to absolutely move forward with our booster battlefield assessment. The World Health Organization has surely not displayed actions that would make me confident. And like I said, I'm going to probably get in trouble by saying that, but we're going to continue to work with the folks in the United States and from the standpoint of the FDA or the CDC, but without any question, period. From my standpoint, the confidence level I have in the World Health Organization is surely not high. And I hate to say this, but in addition to that, we need to be protecting and looking out after the folks in America. In my opinion, first and foremost, we need to be paying attention to what's going on in the world and contributing every way we possibly can. But we really and truly, in my opinion, need this data, and we're going to move. We're going to plow forward here in West Virginia anyway.
All right, thank you, Mark. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. This is for Superintendent Birch, and it kind of goes back to the battlefield analogy that the governor and the general have drawn about COVID-19. In individual schools, will you have a way of knowing what the level of vaccination is with teachers, staff, and students? And I guess that would be outside of maybe the contest between the schools to get vaccinated. Thank you.
Yeah, that's actually, there's already a mechanism to work directly with the local health officials and DHHR. So our school superintendents and even down into the principals, they're able to assess in the schools the level of vaccinations. DHHR has done a great job. We get to see the data each and every, well, it was 2 days a week, now 3 days a week, on vaccination rates. And a lot of that, just like the outbreak rates, are shared with the school leaders, so they are able to assess levels of vaccination in their schools.
All right, thank you, Paul. Next to Mark Cram with WDVM.
Good morning, Governor. Good morning to everyone. Good to see everyone. Just a couple of questions. One, a couple of weeks ago, one of my reporters cited some CDC information in a report that they did. We did it basically because we were comparing our neighboring states around West Virginia. We received an email from a nurse who took us to task saying we had the wrong information and that we should reference the West Virginia DHHR for the correct information. If you look, there does seem to be some sort of a disparity there. I'm sure this is in regards to the matter of compilation of data and turnaround time and so forth, but maybe it's good to just remind folks why there may be seeming disparities there. Second question that I had was the antibody check, is that free or would I have to pay for that? Thank you.
Mark, I can answer the second one from the antibodies check and everything, but we want it to be free. Right now, it's free, and from the first part, you know, that's beyond my pay grade. Secretary Crouch or Dr. Amjad, y'all have got to answer that.
Thank you, Governor. Yes, that's a good question, Mark, in terms of the data. We've talked about that a little bit in the past. There is data at CDC that includes individuals who receive vaccine directly from the federal government. Those are some public employees in the federal government who work in the FBI. There are also, in terms of our long-term care facilities, we have some folks in those long-term care facilities. I'm sorry, let me start again. We have some folks who are in two facilities in the state or three facilities in the state that receive vaccine directly from the federal government. We also have individuals who get their vaccine out of state. They have either on proximity counties, they go to pharmacies across the state line. That information doesn't always get back to us. So there's a variety of information there. So I apologize for confusing you with that if I did, but there is some distinct differences there that we have.
All right, thank you, Mark. Next to David Beard with the Dominion Post.
Hi, I've got a quick follow-up and then my real question. The follow-up is, how do people who are eligible for that battlefield assessment, that antibody test, sign up for it? And then the question is, for the governor, you wrote to President Biden about the Milan plant, and Joe Manchin and Barbara Fleischauer and David McKinley all heard back from CISA after their letters. I wondered if you heard back from either the president or CISA and what they said to you. Thanks.
David, you know, gosh, I know, I can't believe it. 3 times I'm going to say I'm going to get in trouble about this, but, you know, I sound like President Biden. You know, God knows I don't want to do that. But David, there's no way around it. I am really, really disappointed by the federal response in regard to a catastrophe that's going on right there in Morgantown. The people will never know how hard we've tried. I mean, we absolutely have flipped every rock that I know how to flip. And absolutely the response and you know, and whether it be, you know, that Senator Manchin, Senator Capito, our congressmen and congresswomen, you know, or women can do more, I don't know. I just don't know. And I really truly believe that they're trying and they're trying hard, but I know that we are, and I know the federal response is nowhere close to what it needs to be. That's just all there is to it. You know, you've got a situation where a plant was producing pharmaceuticals, the best of the best of the best of the best. And now we're going to farm that out to India, you know, where the dependability is marginal at best, and we're going to expose the United States and the people of this country and we're going to put that trust in India. I mean, give me a break. You know, what in the world is wrong with us? And why are we not plowing the ground every way we can to save that plant and absolutely do the great work that the founders and everybody did in making that a reality? I don't get it. I just don't get it. But our response has been lukewarm, if not very minimal at best. And I know that our congressional delegation is pushing. I don't know if they can push harder, and I don't know how in the world we can push harder. You know, again, I know this will be a word you print, but in all honesty, I think it's pitiful, absolutely pitiful that our federal government at this time, with something as critical as pharmaceuticals are to our citizens, is just deciding to sit on the sideline and let this catastrophe happen. I think it's pitiful. You know, now, from the standpoint of the first part of the question or the back part of the question, somebody needs to answer that other than myself. Dr. Marsh, maybe it was to you. I can't even recall if it was to you or not.
David, maybe if you could repeat the question, because I kind of lost that thread as well.
Wanted to find out how people who are 60 up, who are eligible for that battlefield assessment, can sign up for it.
Right. So what we plan to do, because of the very aggressive and early vaccination of our residents of nursing homes and assisted living, we are working with the leadership of the Long-Term Care Association to be able to really focus on this population first. And then we will continue to expand that to other folks in West Virginia over 60 years old who meet the criteria outlined by the governor. More will follow on that, but we are very excited and appreciative of the governor's leadership here in helping West Virginia really gather that real world data like the country of Israel has and others, so that we can help the FDA and the CDC determine whether or not it is in the best interests of people in West Virginia and people in the United States to consider that third booster, which may be very critical in allowing them to have the appropriate level of immune function to protect themselves not only against the Delta variant of COVID-19, but future variants as well.
All right, thank you, David. Next to Brendan Tierney with WSAZ.
Good morning, Brendan Tierney with WSAZ News Channel 3 here. My question today is for the governor as well as the health officials on the panel when it comes to the school guidelines that were just announced this morning by the superintendent. And it goes to those health and safety measures that we're looking at with these guidelines. Are you guys going to recommend masks be worn when it's made on a county decision level sort of thing? Because every county will make their own decision based on these guidelines. And we're seeing, Governor, you even said that there's most likely going to be one student in a classroom that has the Delta variant, and it's very hard to stop the spread of that if everyone isn't vaccinated, if masks aren't worn.
Brendan, my feelings are just this. I think we established ourselves to where local folks are going to make local decisions as we go forward. We're going to listen to the recommendations from our education folks, and we're going to listen to the recommendations from our medical, panel and all of our medical community, and we're going to move forward along those lines. I've said over and over, right now, at this point in time, right now, I am not ready whatsoever to issue a mandate that we wear masks in our middle schools or any of our schools right now. But absolutely, I'm going to leave a tremendous amount of that decision to the locals, and because they know best. And absolutely, I will continue to monitor and listen to everything that comes out of our Department of Ed and all through our medical panel, our medical folks.
All right, thanks, Brendan. Next to June Leffler with West Virginia Public Broadcasting.
Hello, good afternoon. I would like to ask another question on booster shots. I had a listener that wanted to ask if they can go ahead and get their booster shot. Mark mentioned that WHO says out of global health equity, maybe now is not the time to do it. The CDC has not came out and say it's time to do it yet, but apparently there are people in that age range that are ready to get their booster shot. So can people do this now? And is there any reason why they should or should not?
June, let me pass to Dr. Marsh, but before I do so, I want to say just this, and this is back to, our team of, General Hoyer, Dr. Marsh, all those folks that are involved. Whatever we need to do to move this thing faster, we're in conversation with the nursing home people and all that to move this thing faster to where our 60-plus-year-olds 6 months out can start getting their antibodies tested and everything. And I tell you, General, I tell you, Dr. Marsh, you've heard me over and over. If we've got 3 on it, let's get 3 more. If we got 3, let's multiply the 3. Whatever we got to do to be able to move this thing faster, we need to move this thing faster. And because it's real live information, it will help the U.S., it will help us in West Virginia, and Dr. Marsh, maybe you could answer the first end of June's question, of whether or not people should just start getting the shots, right now.
Thank you, Governor, and thank you, June. So just let me address briefly the WHO's statement. So many countries in Europe and beyond, including Russia, Israel, Germany, France, are now considering third vaccines. The WHO is asking really that because of the unequal distribution of vaccinations across the world, that they would like to see 10% of the world's population have sufficient vaccine to be immunized. And as we've seen, it does benefit us to have the rest of the world vaccinated, as the 2 most recent variants of COVID-19 came from the United Kingdom, which is the Alpha variant, and then India, which is the Delta variant. The continent of Africa right now is really having a lot of challenges with the Delta variant. And the concern is, as people are not fully vaccinated, that the variants will continue to evolve and become even fitter and more dangerous to us. And the more people that are unvaccinated, the more likely that happens. I think that it's really, really important, though, and this is something that we need to be very clear about. The way that these vaccines have been approved is through an emergency use authorization, which doesn't mean they're experimental and things haven't been done carefully. But this was a ruling and an opportunity that I understand came out of the 9/11 experience, where the federal government would be able then to push forward life-saving, life-sustaining interventions and treatments that would be necessary for national safety. And that indeed is exactly what the COVID vaccines have done. They've saved innumerable lives in our country and in our state, but they have been carefully evaluated by the FDA, the Food and Drug Administration, and the Centers for Disease Control. So until the FDA and CDC gives guidance on including a booster shot, which they have not, then we would not be able to support people getting the 3rd shot of vaccine, which is exactly the reason why we are so grateful to the governor's leadership that we could be put in the position where we could help find, develop, understand the real world data in a population that's been vaccinated first, our nursing home population and many of our elders. So then we can look and see what that time from the vaccines have done to the immune responsiveness of our citizens. But we would say for people out there, do not go to get the 3rd booster shot. It has not been approved by the FDA or the CDC, and it is not under their emergency use authorization. But I know the government is considering this for our citizens, just like others. And in addition, I understand the federal government just sent 110 million doses of vaccine to other countries that had fewer vaccines. So I think we need to look at this not as an either or, but as an and. We want to help the rest of the world be vaccinated, but we also want to protect our own people and our own country.
All right, thank you, June. Governor, I'll turn it back to you.
Okay, well, first and foremost, I want to thank Bernie Dolan and Clayton Birch for being with me today. Bernie didn't get, any questions and everything, and he's probably happy about that, because a lot of times when we start playing ball, you get all the questions, but nevertheless, I thank them for all the great work that they do every day, and I really appreciate them being with me today. Just one more comment, and it's just a follow-up on the World Health Organization and all the different gyrations that we saw, and even the prospect that they were really influenced by the dollars and the contributions coming from China, and they were at one time even referred to as the China World Health Organization. But I have to feel this way. I mean, in all honesty, I totally understand that being concerned about the whole world, because bad things can start in a place in the world a long ways away from here that can cause incredible consequences here. We saw that. We saw that with the COVID virus and the terrible killer that it was or is. But at the same time, my feelings are just straight simple as just this. There's too much discrepancy around the World Health Organization. There's all kinds of issues that have happened there and everything. But the bottom line to what I'm concerned about, and maybe you may call me selfish or call me whatever you're going to call me, it's fine and dandy. I'm first and foremost going to be an American, and I'm first and foremost going to do the right thing for West Virginia. For our folks, we've got a real elderly population, and for our folks, this booster situation may be something that we need to move to, and we need to move to quickly in order to be able to protect them, and that's what we're going to do. I mean, it's just that simple as far as I'm concerned. And I absolutely believe that our folks, if they need help from my side to do more, to get information faster, and absolutely, then we need to do more. But when it boils right down to it, somebody's got to stand up wholeheartedly for West Virginia, and I got a bunch of people that are doing so, but by God, I'm going to be the head of the list standing up for West Virginia. So that's all I got today. I thank, again, Bernie and Clayton for coming, and I do have one other thing. General Hoyer, before you leave, real quickly and everything, if you could go over this, putting COVID into perspective that we got, I think, from you, and if you could go over this real quick, I think it'd be really good.
Yes, sir, Governor. As part of the effort that the governor's tasked us to work data analytics going forward, both predictive as well as looking at what the risks are to West Virginians, some quick analysis by the team at Data Robot that's supporting us. If you go back to 2017 data and you look at the risk of potential loss of life from COVID, based on our 2,950 plus deaths, 6 times greater likelihood than the flu. 6 times more people than in 2017 died from COVID this year or during this time frame than in 2017 from the flu. 1.5 more times people who have died than from accidents in 2017 in West Virginia. So the point we make, and go back and you can look at also related to overdose deaths as well, the point we are trying to make and the information we're trying to provide to West Virginians is get vaccinated. It's really important to get vaccinated based on your risk compared to other loss of life, going back to the benchmark year of 2017. It's really important, West Virginia, that you get vaccinated. Thank you.
Come back to me, George, just a second. I just thought about this, but, I'm pretty decent at math. I hope this is right. But, if you were to look at the number of West Virginians we've lost, and you'd line them up in coffins or line them up in body bags, it would be approaching 6 miles long, 5 miles plus long, you know, of coffins and or body bags. We got an opportunity to stop this. Now, and let me say, my last of my last today is to the Milan people. You know, we're not ready to quit. We're not ready to lay down our pens. We continue to work like crazy to try to help. But I want you to know just this, you know, you got a great congressman, you know, in Congressman McKinley, and I met with him just the other day. You know, we went over and over and over different scenarios. He said it's really hard, really hard, and he's getting a lot of pushback and everything to run a separate bill, to run a bill that is directly towards just this, and they're trying to tag it along on other bills. And maybe that's the only way to do it. But, you know, he needs your help. We need to help. We need everybody's help. Absolutely, if we could just run a bill that basically identifies this plant as essential to our homeland security, it's essential to us and everything, and say we have got to continue to run this plant. You know, it's something that our government should step up and do. That's just all there is to it. We're going to continue to work. There's the potential of other things that are going on that I can't disclose to you, but conversations that are going on right now that could very well solve this riddle in another way. But we're not going to quit working. But I absolutely do believe that the response from D.C. in regard to these great people and their jobs and this great manufacturer and their great performance has been absolutely pitiful. That's all there is to it. Anyway, that's all I've got. Again, I thank Bernie and Clayton for coming, and we're just going to stay on top of this. Get vaccinated, everybody, please.
I'm Dr. Jenny Yost, a physician.